Hello everyone. In this video, I'm going to talk to you about interpretation of arterial blood gas in an easy way, or in other words, it's the basics of ABG interpretation. I am Mrs. Beryl A. Francis, working in the Department of Medical Surgical Nursing in M College of Nursing, Chennai. Well, the objectives are to review the normal values of arterial blood gas, understand the easy ways of identifying acidosis and alkalosis, differentiate between respiratory and metabolic components of ABG, and to elicit the difference between partial and full compensation. What is ABG? Arterial blood gas, or ABG, is a sample taken from the artery. An arterial blood gas test measures the acidity and the levels of oxygen and carbon dioxide in the blood. An ABG test uses blood drawn from an artery where the oxygen and carbon dioxide levels can be measured before they enter body tissues. This test is used to find out how well the lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. The blood is usually taken from radial, brachial or femoral artery. Of these, the radial artery is preferred because it is easy to access. It is a superficial artery, hence easy to palpate, stabilize and puncture compared to the deeper ones. It has collateral blood flow too. The ABG levels are usually in balance when a person is healthy, but when a person becomes sick, all these parameters can go abnormal, and that is when interpretation is of paramount importance. The purposes of ABG testing include: it is obtained when managing patients with respiratory problem, evaluates ventilation by measuring pH, partial pressure of carbon dioxide, partial pressure of oxygen. It aids in assessing the ability of the lungs to provide adequate oxygen and to remove carbon dioxide. It is used to analyze the ability of the kidneys to reabsorb or excrete bicarbonate ions. Now let's see the normal ABG values. pH. The normal pH is 7.35 to 7.45. Next is the partial pressure of arterial oxygen, which is 80 to 100 mmHg. Partial pressure of arterial carbon dioxide is 35 to 45 mmHg. This will tell if the problem is respiratory in origin, as carbon dioxide is regulated by the lungs. Bicarbonate. This refers to the metabolic changes and refers to the renal system, and the normal value is 22 to 26 milliequivalent per liter. Oxygen saturation should be above 95%. We are going to look at three most important parameters in ABG, which include pH, partial pressure of arterial carbon dioxide, and bicarbonate. pH. So the normal pH is, any guesses? Yes, you're right. It's 7.35 to 7.45. pH measures how many hydrogen ions are there in the sample. This determines if the blood is acidotic or alkalotic. pH measures how acidic something is. The body needs a pH of 7.35 to 7.45 to maintain homeostasis. As pH increases, that is a pH above 7.45, it is called alkalotic. It just means not acidic enough. And pH of less than 7.35 is more acidic, meaning too much acid in the system. Now we'll have a quick summary of the three main components in ABG. First is the pH, which we've already dealt. The normal pH is 7.35 to 7.45. If it's less than 7.35, it's considered as acidic, and if it's more than 7.45, it's considered as alkaline. Next is the partial pressure of carbon dioxide. Now carbon dioxide is not an acid in itself. Carbon dioxide becomes carbonic acid, which is a weak acid. Carbon dioxide is a respiratory acid. When you're not breathing adequately, you're not getting rid of the respiratory acid, and this builds up in the tissues. The extra carbon dioxide molecules combine with water in the body to form carbonic acid, and this makes the pH to go up. The normal partial pressure of carbon dioxide is 35 to 45 mmHg. Higher than 45 it is considered as acidotic and lower than 35 it is alkalotic. Partial pressure of arterial carbon dioxide is measured to see how much respiratory acid, which is carbon dioxide, is there in the blood. So once again, the normal value of partial pressure of arterial carbon dioxide is 35 to 45 millimeters of mercury. This millimeters of mercury is a measurement of pressure. Next, moving on to bicarbonate. Bicarbonate is the amount of bicarbonate present in the bloodstream. Bicarbonate, we know it's a base. Normal bicarbonate level is 22 to 26 milliequivalents per liter. Higher than 26 it is considered alkalotic and lower than 22 it is acidotic. So let's now move on to the interpretation of ABG. First, let's see the pH in the interpretation of ABG, whether it is acidotic or alkalotic. So what is a normal pH? Yes, you're right, it's 7.35 to 7.45. So for you to remember, when the pH slides down, that is below 7.35, it is acidosis, and when the pH kicks up, it is considered as alkalosis. It's a happy state when the pH is normal, that is 7.35 to 7.45. Anything below 7.35 is acidotic and less than 7 is very dangerous. Likewise, pH above 7.45 is alkalotic, and if it is above 7.8 it is very dangerous and leads to even death of the patient. So it's a very narrow window and it's very important test done frequently in the intensive care unit to understand the acid-base balance of the patient. In critically ill patients, ABG plays a very crucial role as it interferes with many other processes in the body. Advanced interpretation of ABG, we can understand how the interplay is happening. Next, that is after identifying whether it's acidosis or alkalosis, we need to check if it's respiratory or metabolic. If the cause is respiratory, partial pressure of carbon dioxide will be out of normal range. The normal range of partial pressure of arterial carbon dioxide is 35 to 45 mmHg. Partial pressure of arterial carbon dioxide, lungs and respiration is interconnected and hence it is respiratory. The values that measures the metabolic status is the bicarbonate. Normal bicarbonate levels are 22 to 26 milliequivalents per liter. Bicarbonate will be out of normal limits if the cause is due to metabolic problems. Now moving on to the acid base, we have the mnemonic called ROME. ROME, which means respiratory opposite and metabolic equal. Hope you understand that respiratory is because of the variations in the partial pressure of carbon dioxide, which is an acid, and metabolic is because of the bicarbonate, which is a base. So pH, if it is low, it is called acidosis, and a high pH is considered alkalosis. Respiratory is because of the variations in the partial pressure of carbon dioxide, and since respiratory is opposite, a low partial pressure of carbon dioxide and an increased pH is called respiratory alkalosis. And a high partial pressure of carbon dioxide and a low pH is called respiratory acidosis. Regarding metabolic, it's the same, which means increased pH also has an increased bicarbonate, which means it is metabolic alkalosis. A low pH and a low bicarbonate level means metabolic acidosis. It's simple, just picturize. Carbon dioxide is an acid, so if it gives more acid, it's respiratory acidosis, and if the level goes down, it's respiratory alkalosis. Bicarbonate is a base, and if you have more of base, it is metabolic alkalosis, and if it's less, it is a metabolic acidosis. Now, having understood how to interpret pH, that is acidosis or alkalosis, then how to identify metabolic or respiratory, let's now see what is compensation. Compensation means something that is done or given to make up for damage trouble, or any lack. For example, you're preparing a vegetable curry and it becomes salty. You try to compensate by adding more water or by adding potato to absorb the salt. So it's a sort of compensation or adjustment. In the same way, our body also adjusts. If the lung retains carbon dioxide, meaning respiratory acidosis happens, the kidneys tries to compensate by adding more base such that the pH comes back to normal. And in the same way, if there is a problem in the kidney, the lungs will try to adjust. The three components which we need to look at is to observe the pH, to observe the partial pressure of carbon dioxide, and to observe the bicarbonate. To simplify and summarize, if pH is low and partial pressure of carbon dioxide is high, it is called respiratory acidosis. If pH is high and partial pressure of carbon dioxide is low, it is called respiratory alkalosis. If pH is low and bicarbonate is also low, it is called metabolic acidosis. If pH is high and bicarbonate is also high, it is called metabolic alkalosis. Next, we need to know if it is compensated or non-compensated. Compensated is when one organ has compensated for the other organ. The trick we need to keep in mind is, in compensated, the pH gets back to normal, though the other parameters may be abnormal. Now, compensated respiratory acidosis is when the pH is normal and partial pressure of arterial carbon dioxide is above 45. Compensated respiratory alkalosis is when the pH is normal and partial pressure of arterial carbon dioxide is less than 35 mmHg. Compensatory metabolic acidosis is when pH is normal and bicarbonate is less than 22 milliequivalent per liter. Compensated metabolic alkalosis is when pH is normal and bicarbonate is more than 26 milliequivalent per liter. Now, let's look at some examples for a better understanding. We will have to identify with each case scenario example whether it's acidotic or alkalotic, is the problem respiratory or metabolic in nature, is there any compensation, and is the body trying to fix the problem. So let's move on to the case scenario 1. In this, the pH is 7.55, partial pressure of carbon dioxide is 47 and bicarbonate is 33. A pH of 7.55, so it is alkalosis. Partial pressure of carbon dioxide is 47 and bicarbonate is 33, so it is metabolic alkalosis. Since pH is not normal, there is no compensation, but the organs are trying to compensate. If you observe the partial pressure of carbon dioxide, it is 47, which is slightly higher, and bicarbonate is high. And hence, the kidneys are trying to compensate for the lungs. Hence, the final interpretation is partially compensated metabolic alkalosis. The next is the case review 2 with a pH of 7.38, partial pressure of carbon dioxide which is 42 mmHg and bicarbonate is 25 milliequivalent per liter. Since all come in the normal levels, it is considered as normal. The third case review is a pH of 7.28, partial pressure of carbon dioxide which is 68 mmHg and a bicarbonate value of 26 milliequivalent per liter. pH is low, hence acidosis. Partial pressure of carbon dioxide is high, hence respiratory acidosis. Since the bicarbonate values are normal, it is uncompensated respiratory acidosis. Case review 4. pH of 7.43, partial pressure of carbon dioxide is 30 mmHg and bicarbonate levels of 25 milliequivalent per liter. Partial pressure of carbon dioxide is less, hence it is called as respiratory. We need to note that bicarbonate is within normal limits and pH is also normal, meaning it is compensated. Hence, the interpretation is compensated respiratory alkalosis. Hope you understood about the interpretation of ABG. So, to quickly summarize, an arterial blood gas or an ABG is a test that measures the acidity, that is the pH, and the levels of oxygen and carbon dioxide in the blood. The normal pH is 7.35 to 7.45. Partial pressure of carbon dioxide is 35 to 45 mmHg and bicarbonate is 22 to 26 milliequivalent per liter. A pH of less than 7.35 is acidosis and more than 7.45 is alkalosis. Respiratory deals with partial pressure of carbon dioxide and metabolic is bicarbonate. The mnemonic ROM reminds that respiratory is opposite, meaning if pH is low, partial pressure of carbon dioxide is high and vice versa. And metabolic is same, which means both pH and bicarbonate are both high or both are low. Compensated means pH is normal with altered bicarbonate or partial pressure of carbon dioxide. Partially compensated is where all three, that is the pH, bicarbonate and partial pressure of carbon dioxide, are altered in the process of compensation. And uncompensated is where either bicarbonate or partial pressure of carbon dioxide is normal. So here is a list of references. Hope you understood the basics of ABG interpretation. See you in another video. Till then, take care and God bless. Thank you.